We are observing laser cataract surgery for Willem van Osnabrugge, and this is the left eye. Welcome, Mr. van Osnabrugge. Dr. Shoemaker begins the procedure with a side port incision. This is where he'll instill a little more numbing medicine to make sure Mr. van Osnabrugge stays comfortable. This is the second phase of the laser cataract surgery. The laser system automates two of the more delicate steps, and I'll talk about those when we get to them. Right now, doctor has placed that fixating ring on the cornea to steady the eye while he treats astigmatism, and this means the cornea is slightly oval, so that incision was made where the cornea meets the white of the eye. These paired incisions will relax the cornea so it heals in a more round fashion, and that will help Mr. van Osnabrugge see his best. So in the clinic, there were tests, topographical tests performed so that it's very typical because it is where it is an incision that is near the white of the eye, and you can, of course, tell all the blood vessels. And that bleeding actually helps the healing process to some extent, so it's not anything out of the ordinary. The clear natural lens has become cloudy, and of course now it's called a cataract. That cataract is in a capsule. The laser system formed the opening in that capsule to give doctor access to do his work. It's large enough for his instruments, yet it's so small that it won't compromise the capsule. That means after the cataract has been eliminated from the capsule, Dr. Shoemaker leaves it there, and that's where he implants the new lens. So he's just peeling that membrane away so that he has a porthole there through which he'll place his instruments in just another minute or so. Hydrodissecting fluid is instilled now. The cataract will be easier to remove because that fluid surrounds it and separates the cataract from the capsular wall. So direct removal begins with this next hollow-tipped instrument. The second step that the laser accomplished was the pre-fragmenting of the nucleus of the cataract. So at this point, doctor can use a very low ultrasound energy as he manipulates this instrument. It vibrates, it irrigates, and it does emit ultrasonic waves. So the cataract will disassemble into fragments. And then with an instrument in each hand, doctor will guide those fragments using the instrument in his right hand toward the hollow tip, and the fragments are vacuuming into the instrument on the left. We get a good look at how cloudy his lens has become. All this hazy, foggy material, that's the natural lens. It's such a subtle process that typically the patient doesn't realize the extent of it. Not until probably just about immediately after surgery, he'll look around and say, wow, the colors are vibrant. So doctor has eliminated the nucleus, and this leaves the softer part of the cataract for a different instrument. But look how bright it is already. Looks like he has a light behind his eye. So we get a reflection of delicate vessels all the way back at the retina. It's called red reflex, and that's how it's supposed to look. So he finishes with this handpiece, which irrigates and aspirates those remaining cortical fragments. And that bubbling is very typical because of all the fluid that's being used to irrigate the eye. Congratulations to Mr. van Osnabrugge. He no longer has a cataract in his left eye. And because of the laser technology, he has a less invasive, precise surgery with a very reliable outcome. I didn't mention that opening that the laser forms is very accurate. We did chat about that, but I wanted Willem to hear this. In terms of its shape, size, and centering, that has everything to do with the placement of his new lens, so he gets maximum refraction. And that's why the laser system is such a superior way to go. He's still finishing with the little cortical fragments, making sure that capsule is completely clear. Now some viscoelastic gel is instilled to slightly expand the capsule. The new lens is folded inside a micro cartridge. So we'll see doctor advance the lens through the clear shaft here. and it will unfold inside the capsule. There's the optic. And that lens was ordered for Willem's surgery. It has his prescription. Here's an actual lens. That little teeny guy in the center, that's the size of it.
Oh my. Looks so much larger.
Yeah, just 10 times magnification. So the viscoelastic is washing out while Dr. Shoemaker is centering the lens on the line of sight. Is his second eye scheduled already? Next week?
Next Tuesday, I believe. LASIK Plus was the place that he would say.
The anterior chamber is pressurized. Dr. Shoemaker will hydrate the incisions, making sure they're watertight. And these Wexel sponges absorb viscoelastic gel. Today's surgery was performed in about 6 minutes. And Dr. Shoemaker asks that I thank Willem van Osnabrugge for entrusting his eye care to Center for Sight. You can see these little attachment points. It's actually where these flexible arms called haptics attach. And they keep the lens centered in the capsule until it sort of heals in place.
Mm-hmm.
When the natural lens begins to fog and become a cataract, it gets thicker in girth and in diameter. So the implant goes back more to the size of a healthy natural lens, and it needs a little help to stay centered at first within the capsule, and that's what they do. So he's going to give you a thumbs up and let you know it went just right.
But so they don't remove?
No,
those
he's
little
not.
clips?
He's not aware of those. They stay in the capsule attached to the optic. There's your thumbs up.